All right, good afternoon, everybody. We'll go ahead and get started and dive in. Appreciate, first of all, everybody making some time over, if you're on Central Time, on your lunchtime. East Coast, you're in A time, and West Coast, you're on A time. So I appreciate you taking the time out of your day to jump on and join us for our final part of our webinar series here. And we've had a journey over the last couple of different webinars, which I'll go through. But this is just building on each other to really create an overall program of success on how do you find, onboard, clone, hire, and evaluate staff within the care management industry to really help you drive clinical outcomes. And that is our main function around what we're trying to accomplish here. So for us to get started, first of all, I'll give you a little bit of background on myself. If this is your first webinar, if you haven't been able to join webinar number 1 or webinar number 2, my name's Ken Williams. I'm the National Director for Care Management for Medics. I've been working within the care management space for really the past probably 10 years overall, more specifically the last 5, really diving into helping a lot of our clients, be it a health plan, hospital, ACO, drive performance in their teams and help onboard the right talent to drive a lot of the launches of clinical programs around the country that are going into some new exciting spaces, such as Medicaid expansion or the dually eligible demonstrations, and again, the newly formed ACO models. So I first wanted to do a little bit of a recap on the webinars that we've had to give you an idea as kind of a benchmark of what we've covered and what we've been building on. So our June 8th webinar was really focused on understanding the basics and understanding first the landscape in which you're walking into. We feel that's a really vital eye-opener for a lot of our clients, is to really understand the marketplace and what the marketplace is giving you. During that webinar, we covered just how elusive the care management industry overall is. Even the name, it can be a varying different expectations from a licensure standpoint as well as from a program standpoint. Supply and demand will continue and always will be a challenge within our space. We just highlighted some national trends, some national association trends, and really talking about what was going on there. And then we talked about the shifting landscape and all of the new organizations that are popping up, from population health to ACOs to hospitals starting to join in the care management space more and more day by day. And then overall wrapping your company culture and what you're doing independently into that landscape. And that really set the tone for us to really get into how to start building your winning team. And one of the big pieces that is challenged around the country is that no program is alike. No state programs are identical or perfectly alike, and none of the populations are specifically alike, which, as most of you on this call are clinicians yourself, you understand those independent demographics that affect your program and your niche products that you're servicing. Secondarily, we wanted to cover how to identify and benchmark top performers. We're going to get a little bit more in-depth on that today, but how critical it is to really understand that, the process of building out an ideal candidate profile of what you're looking for. And then we touched a little bit on how we're going to have to cascade into training and then the actual creation of supply, basically due to the lack of supply and ever-increasing demand within the space that we're playing in today. Which leads us to today. The main function of today's webinar and what we want to accomplish is, we talked about a lot of key things on how to get there, but how do you really start to execute on the plan, and how do you continuously evaluate long term. Is it working? Is it not working? And those are the things we're going to cover today. We're going to cover the benchmark that's based on your top performers. We're going to discuss the different tools that you can use to aid in the hiring process to make sure that it is going to be effective from identification all the way to onboarding. Talking about analysis and reporting and how critical that is to be able to get your eyes on this information to effectively diagnose the challenges and issues within your organization and your department. And then how do you can be a little bit more nimble and adjust the qualifications that you're looking for and your identifying criteria based on the results you're actually getting from a clinical outcomes and metric standpoint within your organization. So to first dive in, we'll take a look first at really the benchmarking of your top performers. And this is one of the things that all organizations do a little bit differently. I was just giving a snapshot of how we do it internally here at our organization. And this is the bottom criteria you can see listed across the bottom, saying professional goals, clear vision, accountability. These are things that we've identified as the key performance indicators of an individual within this role. And we do an evaluation quarter by quarter that really makes an assessment of the individual in that role across the organization equally with the same questions, the same rating system, and that's critical to understand how your current employees are comparing against each other. This will help you align and identify who your A players are, who your B players are, and who are probably the individuals that you need to offboard. Obviously you can use this, and we'll get into it a little bit later, as a coaching, training, teaching tool to help identify and improve in certain areas over another. But I think it is critical to have a system and a process here to measure people equally across the board. And I think this is one of the biggest areas that most organizations struggle with, is just we're in the mindset of doing 6-week reviews, 12-week reviews, sometimes yearly reviews, and that's it. And not many of them are structured and capturing data points to be able to measure against each other. So there's a misconception of sometimes who your top performers are based on this information. So that's going to be a critical part, is to have a system and process in play to be able to measure that properly. So let's talk about some tools that can assist us in the measuring and identifying and benchmarking of these individuals. The first being something that we hit on our last webinar, which is the ideal candidate profile. And that is the most critical part, is understanding what you're going to be looking for and what is the person, kind of your perfect person that you can describe, and what does that breakout look like. To go back and show everyone that maybe had missed the last webinar, this is kind of the perfect combination of aptitude, behavior, and competencies that we're looking for in a candidate. We're not just taking into consideration the resume, we're taking into consideration much more. So to cover those things, just to catch everyone up, the requirements are the requirements, and licensure are going to be the licensure of the position itself. Those are kind of a given and must-haves. But we also have to take into consideration the competency and the actual experience level that the person does bring, matched with their natural ability level, the aptitude, and the ability level to fit the culture or the program or the environment, which is why we talked a lot about program differentiation in the previous webinar. And then lastly, probably the most elusive one for everyone is more of the behavioral / personality assessment, and how critical that is to the success of really building out a full functioning ideal candidate profile. And most organizations do pieces of this well, and most of the time you can take out the last two, the aptitude and the behavioral testing and assessments, and they focus on the front end. So you end up finding great individuals with tremendous experience, but sometimes they don't perform in your program. That has nothing to do with the actual position itself. So that's one thing that we'll talk about today. The secondarily piece of this thing, and we talked about how this is the elusive piece of building out the ideal candidate profile, is really the personality assessment tools. And the personality assessment tools are, to me, more of the critical piece. And there are a bunch of different assessment tools that are used across the industry. I just highlighted the three most represented in this space today. But the important thing is to look at what you're trying to get out of your individual piece to fit your culture, because all of these assessment tools, they measure and they track really different things. So really to cover DISC to start off, DISC is more that assessment tool that's going to show you how to improve work productivity, teamwork, and communication. It's more of the how do we improve people how to work together better kind of as a generalization, where when you get more into the Myers-Briggs, it's going to track more of what that individual's preferences are. It doesn't measure any kind of trait or ability or character. It's just going to give them more of a snapshot of what that type of candidate, the environment that they prefer in that environment. The Hogan assessment is a little bit more in depth, where it tries to get more into the predictiveness. And this is where it's going to key in on a person's natural advantages as a person. There's also a book and an assessment out there. It's called Strength Finders, which is also very similar to this. And these are going to be those extra edges someone might have, or the really can also highlight the potential problem areas on an individual or risks in a job. So this will help do a little bit more of the pre-screening to get the right people in the right seats. Where the other ones are a good combination with other items as well, but they're a little bit less of a predictor. So from all of that information, from the ideal candidate profile and utilizing whichever personality/behavioral assessment tool that you feel would best fit your organization, you would then take that information and build out a structured behavioral interview, which customized questions, which will gear answers towards what you're looking for. So you can help weed out from the beginning and hopefully be able to hire and onboard talent much more effectively than you have ever in the past. So to give you an idea of the structured interview, each of these structured interviews, you would really want to have 5 to 7 questions that are focused around the information we found going through the benchmarking of your top talent, the identification of that ideal customer profile, mixed with the motivational interviewing techniques and behavioral interviewing to kind of guide them to answer questions strategically and honestly, and not have the opportunity to be biased. And again, this goes back to the same thing we talked about with benchmarking. It's got to be a consistent method that you're using when you're interviewing talent that comes into your organization, so you can properly measure one against the other. when you have multiple different templates and questions that you ask different people, instead of the similar questions with a guide of what's good, a good answer, a great answer, or a mediocre answer, it's really hard to really assess people against each other. So to give you an example of what a typical question would look like and how you would do this to capture the data points, I put an example on the screen. So in a typical fashion, this would be one question that you could ask a candidate is, describe a time when you went above and beyond in your job duties to help advance your career. And there are different indicators that are listed here for the interviewer that they can choose from, that they're trying to take from the candidate's response. And you notice there's only 5, and there's no text box here. This is designed this way so the interviewer has to choose these criteria that they hit on, and only these criteria, because these are criteria that are built off the ideal candidate profile. Secondarily, was there relevance to the candidate's example that they gave? Sometimes we've interviewed people, and you know this, they talk in a lot of circles, maybe they don't answer the question directly, and that's very critical to, they might just be trying to search for an answer. So we want to really outline how relevant their example was. And then if we have any notes specifically on that question, we can document them here in free text form. But the key here is going through this structured interview is not a piece of paper that you're writing on in front of you and you're kind of bouncing around from question to question. It's a very specific format that can capture the data points and house them in direct comparison to everyone who's went through this process. And that's such a critical piece of this, is to be able to utilize a lot of different survey systems that are out there and a lot of different technologies to help you build this into a very good process and customized process for yourself that you can tweak and use that can help drive those benchmarking reports as well. So without that, technology and data points obviously drives to reporting and analysis. And I can tell you internally, even within our organization, we've made some major strides over the last couple of years in this arena. And there are really 3 main buckets that we want to look at around reporting and analysis in regard to performance in the job. There are major ranges across organizations of how advanced some companies are in this arena. Some don't have any. Some have some in Excel. Some have data analytic teams like we do internally today. And there's a variety of different stages of where you're at. So I tried to bucket this into 3 main areas that even if you don't have the technology today, the mindset around I need to track this information in these buckets will hopefully be helpful. The first of which being pure activity, tracking week over week, day by day, and if need be, hourly by hour on, are they actually just doing the work? Are they doing the inputs? And that's a coaching opportunity of, do they have the skills or ability to actually just do the inputs? Secondarily, after you can identify are they just doing the inputs, maybe they are doing a ton of inputs. Well, maybe they're just doing the wrong inputs. And this is where we want to do more of an analysis of where are your individuals spending their time? Because a lot of times they might be spending their time on the wrong activities or too much on one activity, and it helps you identify where they need additional coaching or teaching or structure to help them get faster or better. And then the last one is really about the ratios of, and I know this is more of the critical piece of the care management piece when it comes to quality and clinical outcomes, is what they're doing actually getting the result that they want. So you can start to draw direct ratios and comparisons to understand how good these individuals actually are and start to draw conclusions. But again, a lot of this is tied to having the right structure on the front side and taking the time to really build out how you want to measure, what you want to measure, and stick to the system and process of measuring everything equally. And you can adjust these measurements over time, but it's just important that you measure every individual in your organization equally so you can start to see relevant trends that you can start to draw some conclusions around. And that's probably the biggest piece of this to tie it all together that will allow you to start to adjust and improve and tweak long-term your performance. So I showed you a graph earlier in the presentation just around a typical measurement of how to benchmark an individual based on the average of everyone else, so you can start to see your high performers. This is more of a long-term performance management system on an individual that you can look at quarter by quarter by quarter to see, are they improving in certain categories? Are they declining in certain categories? Again, individuals are very similar to businesses where you can't work on everything at the same time. That's really difficult to do. But what you can start to do is work on pieces and work to get more proficient in certain areas each quarter and show some major improvement overall over the course of a year to 2 years. You can start to see some major adjustments and changes in an individual's effort. And again, this helps us diagnose and identify, based on the key performance indicators of where a person is aligned, are they doing an effective job in their role, or are there some natural tweaks? And again, taking this information and tying it back to how well they fit the ideal customer profile, you can start to draw some conclusions around maybe we need to identify a person that better handles structure and process, or maybe it's, hey, we need to identify a person because it looks like they're doing all the things right, but they're just not getting the outcome because they're missing some cues. Maybe they need to have a higher emotional intelligence to catch on to certain things that can help close some gaps in care that maybe a more structured person is just glancing right over. So gives you some live examples of long-term how you can manage up or potentially manage out. And there are a lot of organizations that go through this exercise and go through this process that can start to identify the top performers and why. But more importantly, start to identify those individuals that they most likely need to replace. And if you could perform this process and get more A players, you could probably even get to the point where you might be able to have a reduction in staff with a bunch of A players, have 10 A players instead of 8 A players and some C players and some B players mixed in. You might be able to have less staff overall. So again, the process of building this all out is very strategic. It takes a lot of time and a lot of patience and a lot of effort. And it's something that as we move into the next 10 years within care management, we've got to start to identify and get really good at this because supply is continuously decreasing. Demand is continuously increasing. And if we don't find ways to identify people in the front end or even get to the point where we can start to predict success by looking at candidates that are not the perfect 20 years of experience in the role, if we don't get there, we're going to struggle to meet the demands and needs of the patients and the members that are out there right now. So to do a full recap of what we've talked about today, focus on the benchmarking properly is your starting point. It's not making gut decisions. It's looking at everyone across the board equally with the same set of criteria and not letting your emotional relationship or emotional experience with a person guide the direction of saying they're a top performer. Second, use tools to aid in building out that ideal candidate profile. So use the assessment tools and figure out which one best fits your organization and make that part of what you're trying to accomplish. Number 3 is to invest in data reporting and analysis. That is a game changer. Having visible graphs and trends that you can look at to make great business decisions, but more importantly, diagnose where there's challenges, which goes right with number 4, is real-time coaching and transparency. When you're able to get to the point where you're providing your employees the transparency around where they're at in regard to everyone else in the organization, they will actively work themselves on getting better. And employees in today's day and age, the 6-month review, the 12-month review, those are going away pretty quickly, and it's more of real-time data analytics they can look at themselves nonstop. So there's not even this formal review. They're reviewing themselves every day, every hour, every week. And that's what you want to create inside your organization. That will just aid in the coaching opportunities that you have. And then number 5, top grade and improve your performance. I think this is an area that we get stuck sometimes in care management, is we have the same person that's been there forever, and we're afraid to rock the boat, and we're afraid to take it to the next level when there's a lot of opportunity to improve performance. And then lastly, again, the individuals that are listening to this webinar and that are on this call are clinicians, and you run the clinical services programs. And this is your team. This isn't a talent acquisitions team. This isn't a recruiter's team. This is your team. And when you think about the process of onboarding, hiring, and identifying, a lot of that is sitting in your human resource department or talent acquisition. And frankly, they don't have probably access to the information on your staff that's driving performance for you. They may be having the 2 buckets that they're hitting. They have the resume, and they have the competency bucket of what their experience has been. But they don't really understand sometimes the population, the membership, and the programs that you're trying to achieve, and that's critical into this whole thing. So the partnership with them is critical. And then lastly, it's the training your team on how to conduct these interviews and having a consistent process around that with those teams. You need to develop a leadership team within your group that is going to be in charge of conducting the interviews and onboarding people onto your team, because you need consistency. If you have one candidate interview with one manager or supervisor or even director, and then you have another candidate interview with a different select group of people, you can't properly compare them. They're going through different processes, they're asking different questions, and they all come from different backgrounds and different opinions. So you're most likely going to get a skewed view on one versus the other. The process needs to be more consistent. So I hope that the webinar series altogether as well is a great opportunity to help you understand your landscape, really show you how to build some teams, and then really how to execute on them and evaluate them to continuously get better. I know that we have our other 2 webinars are up on YouTube, on our Medics YouTube page, as well as our webpage. If you go to medicsteam.com, they should all be sitting under our thought leadership section of our website as well. And those are great opportunities to dig in and go through the previous 2 webinars if you didn't have the opportunity. So I'll jump over to questions and comments here. I know we've got a couple of them come through from a messaging standpoint. So I'll hit those first and then jump over to any questions if anybody has it from the crowd. So one of the questions was really around the assessment tools. It was it was more of a comment / question, and it came from a director of health services, and she just basically stated that she is not the person that's in control of seeing those or choosing those. That does sit with talent acquisition and human resources, and kind of made a comment of like, how do we get this involved if we don't have control of it? And my advice around that is you need to work to actively partner with talent acquisition and human resources. I'd encourage you to share this webinar with them. Talked about how important it is to integrate your teams and the communication around what you're doing, and it should be a collaboration. It shouldn't be segmented, and you guys they're doing their part and then you're doing your part. It needs to be interactive, and if certain processes and assessment tools that they're choosing isn't getting the result that you need, then you need to voice that opinion.